When Dr. Ethan Weiss arrived in New York in late April, he started his first shift almost immediately. Dr. Weiss is a cardiologist based in San Francisco, which has had relatively few hospitalizations related to COVID-19. He decided to help out with New York's massive COVID-19 outbreak because he felt helpless sitting at home. Dr. Weiss was just one of the doctors and nurses from University of California San Francisco's hospital system who risked their lives by flying out to Manhattan. New York City has now reported more than 20,000 deaths. Another group headed to the Navajo Nation, another hotspot, which has lost 6,000 people to coronavirus. In total, about 40 doctors and nurses from UCSF across a variety of specialties flew out to COVID-19 hotspots, according to the chairman of medicine, Dr. Bob Wachter. It's now been about a month since Weiss got back to San Francisco. He's glad that he went, but calls it one of the most challenging experiences of his life. And he's vexed that so many people still aren't taking the public health guidelines seriously. "I'm in a dark place right now," he told me by phone in late May. "Everyone is impatient. A lot of people are feeling done with this pandemic. They don't understand this is how it is going to be for a while." COVID-19 is still a major part of the national conversation, but researchers have found growing evidence of a pandemic fatigue. Many people are itching for life to resume as normal after months of sheltering in place. Moreover, many states are reopening shuttered businesses, and President Trump has stated that he's planning to hold rallies, all which is sending a signal that the pandemic is under control. But as of June, COVID-19 is still spreading in the United States. Arizona, Texas and Utah, among other states, are reporting an increase in diagnosed cases and hospitalizations. Epidemiologists and public health experts remain worried. Now, these doctors are urging anybody who will listen to take the pandemic seriously and keep observing precautions. "There's no way to describe how awful this disease is until you see it," said Dr. Michelle Yu, a pulmonary and critical care doctor from UCSF, who worked at a hospital in the outer boroughs of New York City. "The nurses kept showing up every day, and they will keep showing up, but you could see the fatigue on their faces. It was just horrible," added Dr. Weiss. The San Francisco team noticed that the New York providers, who had been dealing with the situation for weeks, were seriously burnt out by the time they arrived. Some weren't trained to care for patients with severe viral illnesses, but were asked to step in nonetheless. Dr. Maya Kotas, a pulmonary and critical care doctor from UCSF, found herself working with nurses and physicians' assistants who were trained in specialties like neurology or neurosurgery. Many of these providers were learning on the fly. "Doctor,